call this hearing to order. We're going to start this evening with a short presentation by our CEO, Carl Hill, to explain a little bit about why we are looking at a tax increase at this time. So Carl, can you please?
Thank you, Larry. Again, my name is Carl Hill. I'm the interim CEO here at Collin Memorial. And we can go just briefly through our process as how we set our budget for the fiscal year 18. First of all, we looked at history as a comparative, meaning we took the last 2 fiscal years and looked at volume by surgeon, by physician, by discipline. We reviewed the industry trends, the information related to the program we called the 1115 waiver, which I'll explain in a minute. Again, we looked at everything by physician. The first bullet, we looked at by modality and by service line. And then we looked by physician, looking at procedures, clinic encounters, and so forth. We looked at volume growth for our outpatient areas, which are important to us and have seen significant growth. We gained input from all our mid-managers, our directors of all the departments. We reviewed all areas, looking at areas that are poor performing, and there's some listed here: home health, ICU, wound care, emergency department, and some of our clinics. We discussed with our physicians at joint conference. And then this is from our board meeting, we reviewed a draft budget at the board meeting to confirm that the board is comfortable with the goals and the assumptions that our budget is based on. And then in Thursday's meeting, we'll approve not only our operating budget, our capital budget, and the tax rate. What we're seeing in the industry is continued downward pressure on admissions, emergency department visits, because they're the highest cost setting in our whole industry. The most expensive setting is the inpatient unit. The most expensive clinic setting, or it's used as a clinic, is the emergency department. And then throughout our country, and especially in the state of Texas, there's continued pressure on reimbursement, meaning we're getting paid less and expected to do more. So also hospital-based physician practices are growing. Physicians are leaving private practice and moving into hospital-based practices, which we're seeing here in the growth of our clinic system. In the future, there's a move to pay for performance. What that means is, right now, most of our payments are based on volume. If we see more in the clinic, if we do more CTs, if we do more surgeries, we get paid more. In the future, we'll be paid to manage a population, and whether there's more MRIs or not, we get paid the same amount. And so we need to start planning for and be able to be successful in that environment. That environment exists in our market now with both WellMed is here as a managed product from Medicare, and then the Partners in Primary Care across the street are doing that with Humana. We got the latest on our 1115 waiver program. This is a state program that is designed to pull more Medicaid dollars down from the federal government for the state of Texas, and it's going to go through some severe cuts in fiscal year 18, specifically from $3.1 billion down to $1.3 billion. Although they're going to exchange that with improved inpatient reimbursement for our Medicaid. The problem with that is they're taking a lot of money away through the waiver program and giving a very small amount back in the Medicaid inpatients, because we just don't do a lot of Medicaid inpatients. Typically, you see high Medicaid inpatients in programs that have, hospitals that have obstetric programs. Then there's part of the waiver is a program we call Dist, and it's getting cut 60%. Our last program that we would be mentioning is the disproportionate share hospital, and it's projected to be cut 60%. So we participate in all these programs, and at the state level with the new federal administration, and in the environment now at the state government and the federal government working together, we're going to see some drastic cuts, which I'll share with you in a minute. And then we're still subject to meaningful use audits, which is part of our dollars that we got for our information system. And then our clinic system is going to be subject to, and we're famous for acronyms in healthcare, but the program's called MACRA and NIPS, to where if we don't meet certain quality standards, they'll cut our pay 4% in 2018, 5% in 19, 7% 2020, and so on. So we're preparing for that. The pressures that we're having in Wilson County are not unique to our community. We've had, in the last 2 years, those 5 hospitals have closed: Weimar, Dilley, Wharton, Crockett, and Trinity. There's a lot of consolidation in our industry. A huge system in Tyler, Mother Francis, Trinity Mother Francis, was acquired by Christus. Christus also acquired Good Shepherd in East Texas. South Texas Regional here in our market was acquired by HCA, which owns Methodist here. They also acquired Tomball. The East Texas Medical Center system, which is another huge system. Since our meeting, they've signed a letter of intent to be acquired by a company called Ardent, another for-profit regional company. Bounceville Hospital is up for RFPs, and then Weatherford was just recently acquired into the HCA system. Specific to our market, besides South Texas, HCA Methodist is now managing Del Rio, Hondo. They own Pleasanton. That should be Pearsall. They own Jordanton and Cuero. Tenet is looking at putting something in Livonia. We've heard confirmed rumors of that. Of course, we have the freestanding emergency department in Livonia. There may be one coming to Floresville. The WellMed has continued to expand. So there's a lot of activity that's happening in our market because of our growth and the good payer mix that we have here in Wilson County. So we based our budget on these assumptions. We're going to combat the trend of downward pressure on inpatient admissions because we're growing and increase our admissions 3%. The emergency department's going to stay flat year over year, but our admission rate's going to improve slightly because we have new medical director leadership there, and he's working with the docs to keep and not transfer out as many patients as we've been transferring out. Our outpatient volume's growing significantly, 5 to 7%. We have a new MRI, so we believe it's going to grow faster than the outpatient rate. And then our clinics, because we have 2 new primary care doctors, and our new doctors continue to mature, that they're going to grow 22%. Based on the changes that are hitting us, though, this is the amount that we have to overcome. We're expecting $3.6 million in less reimbursement this year, fiscal year 18, compared to the current year that we're in. So as I mentioned, the disproportionate share program is the hit that we'll be taking, $647,000. We're also currently known as a low volume hospital for Medicare. So the low volume adjustment, the LVA, is not going to be continued after October 1st or starting October 1st. That's a $400,000 hit. The waiver, the district I mentioned, 60% cut. It's $550,000. The waiver through our partner at South Texas is projected to end December 31st. So 9 months of that benefit would be about $700,000. Our partner in Good Shepherd has terminated the agreement effective October 12th. So that's $1 million hit year over year that we will receive. Medicare is paying less for laboratory. We've estimated that to be $93,000. And then this is, we have 2 new primary care doctors starting up, and they're just expensive. It takes them a while to generate enough volume to cover their expenses. And so in our budget, we estimate that to be about $170,000 hit. We do have some positives. We've converted 3 of our clinics to rural health clinics. That's about $150,000 more in reimbursement that we'll get this year over last year. And we've focused pretty heavily on our billing this past 6 months and improved our billing operations. We've reduced our AR days, just saw this today, 12 days for the clinics, which represents about $500,000 improvement, and about 14 days for the hospital, which represents, or 8 days for the hospital, which represents over $1.2 million. So just by reducing the errors, getting the bills out quicker, and following up, we've been able to reduce our accounts receivable, and we expect that to continue next fiscal year. Bad debt and charity care will stay about the same percentage over fiscal 17 to 18. Again, that's a pretty bold statement on our part because bad debt around the country for hospitals continues to increase. As employers continue to have high deductible health plans. People were not prepared for that, so their deductible goes from $2,000 to $5,000. They come to the hospital. If they're not prepared for that, most times that ends up being bad debt. So we're working hard on our upfront collections, and we're not showing any reductions in Medicare payment year over year. As far as the expense side, this is my last slide, and then we can take comments. We're projecting a pretty aggressive reduction in supply expense, buying some high dollar supplies much better, making sure we're using our group purchasing organization, maximizing that. We're showing a reduction in drug expense. Sue's worked with the pharmacy and the medical staff to reduce our formulary, so we're not carrying drugs that we're not using any longer. They're not expiring. And we're looking at substitutions, making sure that we're doing everything possible to get the right drug at the best form. Switching to by mouth versus IV, those kind of things help save drug costs. We do have a merit increase for our team, January 1st. We're going to be looking at some of the personnel policies as it relates to sick leave and paid time off. We are going to, like all employers, we're going to look at our health insurance. It's up in May 1st. This year we did not have an increase in our premiums, which is unheard of. So we're looking at modifying our plan and continuing to encourage our employees to use this hospital first when appropriate. And then in the budget, we have a $300,000 cost reduction initiative. This will be driven by our new Chief Financial Officer. They'll have a year to identify different savings throughout the year and just bring his or her experience in to help us with that. But we're also growing our business, and to do that, we believe we need to market. So we've got a very aggressive market plan that our board has approved. We're well into that plan, and so what we're spending on marketing will be $100,000 more than it was in fiscal year 17. So these are the assumptions that our budget was based on. You can tell that we have a lot to overcome. These are real numbers. I'll be glad to explain them further if needed. But we're trying very desperately to overcome some pretty big hits that weren't anticipated. These are all have developed over the last 4 or 5 months. Without exception, I believe. So, a lot of aggressive actions being taken at the state level and at the federal level as it relates to hospital and clinic reimbursement.
Okay. Thank you, Carl. Our first speaker tonight, citizen speaker, is Carter Thomas. Would you take the podium and read a 3-minute limit?
First of all, I'm Carter Thomas. First of all, I'd like to say I think there may be some disagreements tonight, so let's all agree to disagree agreeably. First question I have is, I'm disappointed all the boards out here. Do you have bylaws that says what a quorum is? Is this going to be a good meeting?
This is a hearing and not a meeting.
Okay, all right. Number of questions. December of 2016, an article in the DallasNews.com stated that 61 hospitals in Texas were going to lose funds in 2018 because of CMS, the Center for Medicare and Medicaid Services. Guidance weren't followed in antibiotic resistant organisms that would be in the hospital. Conley Memorial was one of those 61. On August 17th, Mr. Hiddle stated that this, I guess the budget problem, was affecting every hospital in Texas. I'm just curious, which is it? Is this, are we thinking about raising taxes because of the funds for not following CMS guidance? And I'll respectfully say these things about Endeavor, because I really do respect the people at Endeavor. But it's, I think, common knowledge now that about $125,000 a quarter was the bonus in the last couple of years, running a CEO salary through it, plus some other things that would have been between $750,000 and $1 million running through Endeavor. My question would be, if Endeavor was in charge when Brian Burnside was hired, and we had financial issues that caused him to be fired, and was in charge in giving guidance when the CMS guidance weren't made, why, and we're losing money at the federal level because of that, why are the people of Wilson County potentially being disadvantaged for those kind of actions? Okay, I see the board here has a fiduciary responsibility to the taxpayers of Wilson County, not to Endeavor, not to other entities. So if you have hired a good CEO, which I've read, and I have no doubt he is good, why do we continue to need a relationship with a consulting firm that is going to cost us up to just short of $1 million a year, maybe $750,000 a year, when they were responsible for the hiring of the last CEO that had to be let go, and were giving advice when according to the Dallas News, we did not follow the CMS guidance and are being penalized.
That's 3 minutes.
Okay, a couple of questions there, thank you.
Next speaker is Jim Long.
I think what Mr. Thomas referred to in his article was the hospital-acquired condition reduction program, which has a 1% penalty to it, which I didn't see in your presentation. It may have been there, I just didn't recognize it.
No, it was not.
Okay, so there's a 1% that you're gonna hit in 2018.
That's for this current fiscal year.
Okay.
And anticipated for next year.
How much is that?
About less than $50,000 a year.
Okay, so your Medicare is not that big.
The percent of that. It's a
Okay.
$33 million budget, so
Okay.
50,000 on 33.
Very quickly then, I just retired in October from 16 years in the Austin Diagnostic Clinic, and I did a lot of analytics, and I did meaningful use of PQRS and performance and all that kind of stuff. The point I'm going to make is that since it appears, at least for 2017, you're getting a penalty for not meeting that reduction program, I was curious what kind of analytics and what kind of program you have in place to monitor that stuff on a month-to-month basis so you can take corrective action. You don't have to answer me, I'm just asking that question. The other point that I wanted to make surrounding that is because you had that particular issue, you've already got a problem with the reputation for being too expensive. This particular issue brings up a reputation for not necessarily providing quality care. Do you have as part of your marketing plan, do you have some way to cover that? Again, suggestion. And the last thing will be actually good words. I was a patient here about 9 months ago for several days. The staff and the doctors did a great job. I've been in other hospitals in big cities, and the only difference I saw was you had some shortage in staffing here that I didn't see in other hospitals, and you had older technology that I've seen in other hospitals in some minor areas. But all in all, good visit for me. Okay.
Next speaker is Russell Bicker.
I guess it's for 3 minutes, I'll keep it short. Yes, this hospital is expensive. I pay, if this, according to the paper, it said their proposed rate was to go from 11.29 to 13.83, which is a 22, almost 22.5% rate increase. And that's going to jack up my taxes to just shy of $400 a year for a hospital I have to drive past if I want to get care. The only part of this system I really even use is the clinic. And you know, because our primary care physician is off in the clinic's office. My wife needed a facial CT. You know, she has used the ENT here. Facial CT, they tell me, I ask them how much is it going to be, and they tell me that I'm going to need to bring $400 or whatever. I can't remember the exact amount. So okay, then I dig a little further. Is that my total cost? Oh, well then he comes up, oh, it's going to be $1,800. So you're not telling me the full cost up front. You're telling me how much I need to bring in a check the day I show up. You're going to bill me for the rest, surprise, later. I go to New Braunfels, open an MRI, get the facial CT, $300 cash on a barrelhead, walk out. Okay? If the government isn't paying your bills for you, if you're not on Medicaid, you're not on Medicare, and you've got, a $5,000 deductible on your plan before the insurance company ever pays a dime, you're not gonna come here. I don't come here. I go all the way to Baptist up here and where I do not pay taxes. So what am I paying $400 a year for if I can't even use what the hospital that I'm paying for? And a simple thing, my wife got a flu test, and it's $160. But CVS over here offers the same test for $35. I mean, that's ridiculous. Even my insurance negotiated rate is $80 for a test that's $35. And I brought this up with Burnside 4 years ago. I sat and met with him about this nonsense. And everybody in the county feels it. I think that when stuff like this comes out, if last cycle's 27% was passed, and then this would have piled on top, it would have been basically over a period of a couple of years, a 50% increase in our taxes. And still for a hospital I have to drive past. Thank you.
Next speaker, Mary Helen Teagan.
Thank God we live in America and we have the opportunity to express our concerns. I feel your pain, guys. I'm a Medicare provider as well for home health and hospice here in town. And when I'm looking at your budget analysis up here and the things that you've cut, I'm a little, and we don't have the detail, I realize that, but can you explain to me merit increases, personnel policies, and health insurance modification? In my business, there have been no merit increases in probably close to darn near 5 years because of these cuts. And believe me, these cuts are real. These are not things that are just incidental. They're deep cuts, and we're all facing these as Medicare providers. So if you're having a hard time meeting your budget, how are you giving merit increases? I understand the politics of it, but realistically, if the money ain't there, and you're asking us to do this, to pay for this, as a provider, as a citizen, as a taxpayer, I would say, please put some thought into that. The other thing, you talked about, I think, reinstituting, or I don't know what the word was, personnel policies. What exactly are you talking about? Are you talking about, you said something about the PTO policy, or you're revising some of them? Is that
Yes.
reducing, I assume?
Yes.
Okay. What are you doing about the number of personnel? Are you stretched so far, so thin, that you can't reduce personnel? We've all had to do this. You bite the bullet and you do it. So that would be one thing that I would question in terms of what are we doing to reduce these numbers? It's a real deal. It's not something that you can leave off the table, in my opinion. The health insurance modifications, it's nice to have a nice plan, but if we can't afford it, we can't afford it. And I haven't provided health insurance, and I hate to even have to admit that, but I haven't been able to afford it in years. From when ACA came into being, that's when I couldn't afford it anymore. Otherwise, I was paying up to 80 to 90% of their premiums. Can't do it anymore. So whatever we do here, you really need to take a hard look at what's real. And last of all, management fees. I didn't see anything about management fees up there. What have we done to reduce management fees? Anything?
I'll respond.
Yeah, we're gonna wait till the end to
Okay.
respond to these points. you guys
Okay,
have.
all right, well, I'd appreciate that.
We'll waste the time that you have.
Sure, okay. I guess we need a hospital. There's no doubt about that. I mean, when I think about how dangerous it would be in certain instances not to have a hospital in our community, I shudder to think what would happen. But as a business owner and as a taxpayer and as somebody who has used these facilities and family who has used these facilities, I'm begging you to pay attention to what the rest of us have to do. Just because this is a taxed entity and you get those monies, we are all suffering. So we have to live with what we can pay for. So, appreciate that.
The next speaker is Joanne, and I apologize, I
Oh, try. U-Haas.
Okay. I'm sorry.
U-Haas.
U-Haas,
The
okay.
J is just silent.
Okay.
First of all, thank you so much for having this public hearing. Really appreciate it. It's good to see so many people interested. What concerns me is possible legal ramifications. When I went online to find out a little bit more about what was going on, there is an actual attorney that is advertising. It's Painter Law Firm, and he's out of Texas. And he's advertising for malpractice. And Floresville's Conley Memorial Hospital is listed. If I may read a little bit of what he has in his page. The federal government realized that these medical and hospital errors were costing Medicare and Medicaid lots of extra money. As a result, the Affordable Care Act started the Hospital Acquired Condition Program, which monitors infection and injury rates and hits the worst performing hospitals where they feel it in their pockets. The penalized hospitals on this annual list are hit with Medicare and Medicaid funding cuts for failing to make the cut on quality measures that include, and then he lists all the measures. My question is, what do you have set aside for possible legal ramification? Because there must be some issues, and what do you have set aside? Can this affect us even having a hospital? One of the reasons why my husband and I moved here, instead of Lavernia, honestly, was HEB and Conley Memorial. This is a large concern. And when I read the quote in the newspaper that Mr. Hiddle said that this is affecting every hospital in Texas, well, some of this is not affecting every hospital. It's specific to certain hospitals. And that's only 61 in Texas and 769 nationwide. We want to help you correct this, but we also do not want to be punished for your errors. Thank you.
Next speaker is Sherry Schofield.
No, thank you. I thought I was just trying to.
Okay, all right. Next speaker is Peter, and Peter, again, I apologize.
Same last name.
Same last name.
Same last name?
I yield my time to Carter Thomas.
Okay.
I already spoke.
Carter, do you have anything else?
Well, let's see.
Thought you weren't finished.
Well, my only, I had two last questions, and I'm hoping to get them answered, is were the 61, does this issue truly affect every hospital in Texas, or are they countably for you 61 that was in the Dallas News in December correct? And secondly, I want to just had a question, I'm going to repeat what Joanna said, is we are being, it appears as though we're being penalized for mistakes made by the board. Now, if you've got to have, if you're going under, that's one thing. But if you're, last year you went for, 27-8% increase, and you said then you could have gone 8 at a time, and you're doing it, and now you're coming back and going 8 at a time. So, and the last question is, with Endeavor on the payroll, if they weren't on the payroll, would you need to raise taxes?
Next speaker is Kay Love.
Real brief, I don't have a lot to say. I just, we spanked you last year. Don't make us spank you again this year. I think you think that we have Endeavor managing the hospital. I think Endeavor is managing the board. You look out there in that parking lot, and I don't see anybody that's driving a Cadillac. And I don't think anybody except this board wants a Cadillac of a hospital. We need a Ford to keep it going. If we try to keep running the Cadillac, we're gonna run it right into the ground. Thank you.
Next speaker is Virginia, and I apologize, I don't have your last name.
It's Glocka, but I wasn't.
She just signed
She
it.
just signed
I
it.
just signed it.
Okay, all right.
I'm sorry.
She thought it was a requirement.
Anyone else that would like to speak that has the opportunity? Okay.
I have one question. Oh, no.
If you would, please identify yourself with the crowd.
I'm Paul Brewer. I'm a resident of Lavernia. I've been a resident of this county since almost I was born. I've been here, over 35 years. Graduated from Floresville High School. I'm the head of Laverne EMS, and one of the questions I have, which is just a concern because we've been looking at it at the EMS, is just something to bring up to think about is balance billing, and then removing that as possible.